23-year-old black female complains of chest pain, radiating to her neck, and shortness of breath. Antoinette, we're gonna get you up and get you on the bed, okay?
All right, let's go.
1, 2, 3. Alright, stay sitting up, okay?
Alright, pick your feet up.
Keep your head elevated if you can. You wanna lift your head up, Antoinette?
Yes.
Okay, we're gonna lift the head up.
Alright. So my name is Bailey. I'm gonna be your nurse today. Can you tell me your name and date of birth real quick?
Antoinette Cardio, April 13, 2020.
Alright. Do you have any allergies I need to be aware of?
Penicillin.
Penicillin, okay. And do you have any previous histories that I need to be aware of? Past medical history, anything like that?
I've had blood pressure.
High blood pressure?
Yes. I have that.
Alright. Do you have any history or family history of heart problems?
Yes.
Yeah.
My grandfather died of heart attack.
I'm sorry to hear that.
Am I having heart attack?
We're gonna try to figure that out, okay? I don't want you to stress out.
Okay.
Alright. I'm gonna go ahead and listen to your heart real quick. Alright. I hear some S3 and S4 murmurs going on. I'm gonna get my aide in here and she's gonna help me with the rest of those vitals, okay?
Hi Antoinette, I'm Rebecca. I'm the nurse's aide. I'm gonna get your vitals, okay? Can I get your finger really quick?
I meant to ask, on a scale of 1 to 10, how would you rate your pain?
9.
9?
Blood pressure is high, 168 over 98. We have a pulse of 92. Respirations are 26, and temp is 98.9.
And what was the oxygen?
Oxygen 93 on room air.
Okay, let's go ahead and put her on a nasal cannula to the ears right now. Try to get that up.
Antoinette, I'm gonna give you some oxygen, okay?
Okay.
Alright, and while she's doing that, I'm gonna get you hooked up to an EKG, okay? So we can figure out what's going on with your heart a little bit more in depth. So go right here. Right there. Sorry, it's hard to remember where these things go sometimes. Alright. Get that reading. Alright. We're gonna call the doctor real quick and see what she wants to do, and then we'll come back. Hopefully with some medicine to help you feel a little bit better, okay?
Okay.
Alright. I'm gonna call the doctor. Hi, Dr. McNally. Hey, I have a patient in the ER. Her name is Antoinette. She's 23 years old. She has a history, she is a smoker. She has a history of hypertension, and she has a family history of a heart attack. She said I think her uncle died of a heart attack. Her pain level right now is a 9 out of 10. She's got chest pressure radiating up to her jaw. Her blood pressure is 168 over 94, heart rate 108, respiration's 26, and O2 is 93.
Okay.
So I put her on a nasal cannula, 2 liters. She's very short of breath. We did get an EKG and it shows ST segment depression and T-wave inversions. And yeah.
Okay, let's go ahead and order labs and troponin, CBC, PTINR. We've already got the EKG. Let's go ahead and give her an aspirin and nitro right now, and also heparin,
Okay.
and then we'll go from there.
Okay, thank you. Alright. Okay, so we've got you some medicines right now. I'm gonna give you some of that while my aide Rebecca, she starts an IV on you, so it might hurt just a little bit, okay?
Open that, cleanse your arm. And just clean it with a little alcohol swab, okay? Clean it with alcohol, ready? You're gonna feel a little poke, okay? There we go. Alright, now she's in here to make her medicine, okay? To give you your medicine.
Alright, and here's the aspirin, and then we got it's a sublingual nitro, that should help with your chest
And swallow
pain.
too?
No, you just keep that on your tongue, let it dissolve, okay?
Okay.
And then I'm gonna get the heparin, through your IV, okay, so you don't have to worry about that. Alright, and then draw the laps up. Okay, give us about like 10-15 minutes and then we'll be back, okay, to see how your pain's doing, alright?
Okay.
Call the doctor.
Dr. McNally?
I got the lab results back from Miss Antoinette.
Okay.
Her troponin is elevated. It's 0.87 mLs.
Okay,
CBC
so that-
was elevated.
Uh-huh.
You've seen the EKG. The CKP is elevated, and so is the PT and INR.
Okay. Definitely looks like there may be a heart attack going on with everything being elevated. Let's go ahead and send her off to get a heart cath, just to see if there's any blockages going on, and then, we'll discuss further what to do next, okay?
Okay, thank you.
Uh-huh.
Alright, that's not. So we are gonna send you off to get a heart cath, just so we can see if there's any blockages going on, and maybe that's the reason why you're feeling like this. Do you know what a heart cath is? So the doctor is gonna stick just a tiny little, it's not really tiny, it's pretty long tube. It goes up your femoral artery, and they're gonna go into your heart and see if there's any blockages, like plaque or anything going on there. Alright, do you have any questions?
Are you gonna put me in anesthesia?
No, it's just a minor procedure. You shouldn't be, they're not gonna knock you out. Okay.
Okay, alright, she came back from her procedure. It does look like you had a heart attack, Antoinette.
No, you have?
Yes, I know, friend. I have my nurse over here. We're gonna explain medications going home and some discharge paperwork and discharge teaching. Okay, but right now everything's settled, and are you feeling better than you came in?
Just a little bit.
Just a little
Yeah,
bit?
the pain, but it's just really.
Okay. I'm gonna go ahead and give you put in an order for Bailey over here to give you some morphine to kind of help with that pain, and then we're gonna send you on upstairs and all of that, okay? Okay.
Alright. Okay. So the doctor did come in. She did say that you were having a little bit of a heart attack. So you might wanna make a little
Am I
bit
gonna
of.
die?
No, we're not gonna die. We're gonna get everything figured out, okay? So you did say that you are a smoker. So you might
Yes.
wanna, it would be best to try to stop smoking, cause that could be a big contributor to why you had a heart attack. I know you having hypertension also does not help. You might wanna change up your diet, like a low fat, low cholesterol, low sodium diet, you know? And then you wanna really try to limit your caffeine and alcohol intake. That would help you a lot, okay? Alright. And warning signs to recognize if you think that you are having another heart attack. If you, like today, if you're having really bad chest pain that's not relieved by your nitro. If you're if you have shortness of breath, if you're dizzy, and if you feel pressure in your chest, okay? That's some things to look out for. If you feel any of that, I would call 911 or try, if it's safe, to make it up to the emergency room, okay? Alright. Do you have any questions for me?
No.
Okay. Thank you. I'm happy you're feeling better.
Alright, Antoinette, we're gonna get you moved upstairs, okay? Alright, do you need anything else? Okay.
Okay.